Did you know that endometriosis affects 1 in 10 women and is often a cause for subfertility? So today, Dr. Elizabeth Jackson joins us as she breaks down what endometriosis is and the symptoms to look out for. So tell me, first of all, what is endometriosis?
So endometriosis is a gynecological condition, and it's where the lining of the uterus, which normally thickens and sheds with your period, it's where somehow that lining gets outside the uterus. And then when your body has a period, these small little pieces of tissue, they also have a period, and they result in little blood blisters as well as some scarring because it's quite inflammatory tissue, the endometrial lining, when it gets on the outside of the uterus.
Wow, I never knew that. That is so fascinating.
Yeah.
But sounds so painful.
It can be, it definitely can be. And that's one of the things that people might come to see us for.
So tell me, what are the symptoms of endometriosis and how young can they sort of start showing up?
Yeah. Endometriosis can affect everybody from young teenage girls through to women in the perimenopause about to have their period stop. So any woman that is of age able to menstruate can be affected by endometriosis. And the symptoms are most commonly painful periods, but women may also experience pain with when they ovulate. They may experience pain, particularly when they have a period with either peeing or pooing, and they may experience pain with intercourse as well. But there are some women with endometriosis who in fact have no pain. And these women may ultimately be found to have endometriosis either as an incidental finding at the time of an operation for another condition, or in fertility, we see women, approximately 25% of women that have had difficulty falling pregnant after about 6 to 12 months, they may in fact have underlying endometriosis.
So what is the main causes of it? Is it genetic or?
Yeah, so there are recognised a few different causes, but at the end of the day, they don't have one clear answer for all the causes of endometriosis. But a couple of things. So we know that it can run in families. So it can there can be a relationship between mothers and daughters and sisters with endometriosis. Also, something like structural anomalies of the reproductive tract can also be associated with increased rates of endometriosis.
So obviously if you find out or you've got problems and you're wondering whether you've got endometriosis, obviously it's really important that we see a doctor if they suspect they have endometriosis. Why is it important? Obviously because you can do something about it?
Yeah, we definitely can do a lot for endometriosis, but do see a doctor if you suspect you have endometriosis. But more importantly, if you feel like your concerns aren't being listened to, go back or seek an alternate opinion, because for many women, on average, it takes years to find somebody that will give you the appropriate diagnosis. And if in doubt, request a referral to a specialist gynecologist, and somebody trained in reproductive health like myself can assist in either confirming or at least treating the symptoms that may be endometriosis.
Because are there any treatments? Tell me a little bit more about those.
Yeah, so look, at the moment, the current treatments revolve around trying to manage pain and also manage fertility. So the treatments for pain, we talk about with period pain. If you don't have a period, you don't have a problem. So that's a fairly blunt statement, but we can give you a range of hormonal medication that can either be pills or long-acting reversible contraceptives, which are implants and injections. There are some non-hormonal therapies available as well, and these are medications that we use to treat pain or to prevent the progression of endometriosis. And then for people that are trying to fall pregnant, it's a little bit more complicated. So for people that are trying to fall pregnant, we may talk about the role of surgery, where we excise the endometriosis, although there is a role for surgery as well. If you are in pain and unable to be treated with non-surgical methods, we do also in that circumstance as well talk about the role of surgery to treat endometriosis too. And the mainstay of surgery is, at this time, we do laparoscopic or robotic assisted laparoscopic surgery, where we place very small little cuts on the belly and put cameras into the abdomen, and we look and we identify the endometriosis and we excise the endometriosis. And then on top of that, we also treat any scar tissue and perform what's called an adhesiolysis to restore the anatomy back to normal, which will hopefully be able to provide pain relief.
So without treatment, endometriosis can lead to possible persistent pain conditions and subfertility, as Dr. Liz was saying. So while there are currently no absolute cures, I guess, for endometriosis, the symptoms can be managed by allowing you to live a better quality life. So book a consultation today with the lovely Dr. Elizabeth Jackson at Birds of Paradise to support you every step of the way.